Os back-end quem é isso?
Industry Association APEC which is closely working with the Healthcare Council and ASSOCHAM. So again, this important discussion, I would like to take a moment to express my heartfelt gratitude to each. It's not just like daily things, this is very we can insights on the importance of adult immunization, particularly against influenza. As you all know, influenza is a highly older adults, individual with underlying health condition. It's very important for us. We can say this very teenagers. We organize similar discussion, starting from their experts, the policy makers, bureaucrats also. The convention has been enlightening and the preventable disease like influenza.
In skills till March 2024, and I was associated in the context of today's talk with NTAGI. I was probably one of the longest serving members in the NTAGI till last year, and for 12 years. So that's me. Anybody can start. Influenza, and then we can take the discussion forward. It's a ubiquitous infection and affects about a billion people every year, with around 5 million severe infections causing up to 650,000 deaths per year, and a lot of cost to the exchequer. This was one of the papers, recent papers that we published as a part of the Global Burden of Disease, which is a global surveillance and epidemiology done under the aegis of the University of Washington, the Institute of Health Metrics and Evaluation. We looked at the mortality, morbidity, and hospitalization of lower respiratory tract infections due to influenza, and analysis from the GBD. And in 2017, there were 130,000 deaths because of influenza, and influenza lower rate respiratory tract infection mortality was highest amongst adults over 70 years of age. The highest rate being in the Caribbean region, and there were about 7 million hospitalizations, and that constitute about 59 million hospital days. And around 10% of all lower respiratory tract infections were attributable to influenza. So a little bit about the virus. It is a member of the Orthomyxoviridae family of viruses, and influenza viruses are of 4 types: A, B, C, and D. D causes disease in cattle. C causes a mild respiratory illness and is not very severe. A and B are very important in the context of human disease, and A has what we call as subtypes depending on the cell surface antigens that is present on the influenza virion cell surface. And there are 2 antigens that are most important, we call as hemagglutinin HA and neuraminidase, that is NA. So depending on the H and the N, we devise the taxonomy of the virus. For example, you have H1 and you have N7, so it would be called H1N7. You have H2, N2, H1N1, H3, N2, that's how it goes. So, whereas for influenza B, it is important to recognize that there are 2 major lineages. Influenza A, we call them subtypes. Influenza B, we call them lineages. Influenza B lineages are mainly 2, B Victoria and B Yamagata. That's something that will be important during the future context of future discussion that we are going to talk about. And influenza virus has a property of changing its genetic constitution, and it can be a major change in the genetics of the influenza virus, causing the antigenic shift, or a minor change, which is very common, causing it an antigenic drift. These drifts and shifts are important for the immune system, because if your body system does not recognize the virus, it will be infective against this. And that's why antigenic shift is more important, because it's a major change in the antigenic character of the virus, and as a result your immune system does not recognize it, and there is a possibility of getting a severe illness which has a greater chance of transmission, and as a result you can have major epidemics and major pandemics. So how does it present? It presents generally as an asymptomatic infection, can be asymptomatic in up to 50% of the cases, but can present with upper respiratory and lower respiratory tract infections, and it can present with fever, photophobia. Generally, it improves in a week's time, and but you may have cough and malaise that may persist for weeks. Children may develop high fevers that can lead to febrile seizures, and fever may be absent in the elderly. That is very important. So when do you shed the virus? You shed the virus from a day prior to the onset of the illness to about a week or to 10 days after the virus is, the illness is gone. Immunocompromised patients and children are the ones in whom there can be a prolonged shedding. And there can be complications as a result of influenza infection, and they can be respiratory, like pneumonia, acute respiratory distress syndrome. There may be secondary bacterial infection, and there are many other organ systems that can be involved as a result of influenza infection. And sometimes we may have unusual infections, like in this patient we had a diffuse skin rash and a subconjunctival hemorrhage in an adult with pandemic H1N1 virus. It is an etiology of community acquired pneumonia, and in this study we have shown that this is the third commonest pathogen causing pneumonia in hospitalized infections with pneumonia. And you can see Streptococcus pneumoniae being the commonest organism, followed by Legionella pneumophila and influenza in a study done in skids.